My name is Sanam Ahmed. Today is Saturday, April 4th. I'm a critical care attending with the Institute for Critical Care Medicine at Mount Sinai Hospital. I'm doing a night shift tonight, and I will be responsible tonight for critical care consults on COVID patients, which means that myself and my team are responsible for stabilizing the sicker COVID patients, putting them on a mechanical ventilator for those who need it, and then facilitating a smooth transfer to the ICU. I just parked, and I'm about to enter the hospital. I guess when I left my house today, I sort of had mixed feelings. On one hand, I left my kids at home so that I could go and fight this war along with my colleagues. But on the other hand, I feel optimistic. I feel hopeful because as a critical care physician, this is what we've trained for. We know that this is what we have to do, and we know that we're well equipped to do it. I also feel hopeful because despite how challenging my night will be, we hear good things every day. Today, before I was leaving the house, one of my colleagues had texted, and she just texted a number. She texted a number and said, "This is the number of patients whose lives we have been saving over just the past day. This is the number of patients that we have successfully gotten off of a ventilator." It's sort of a reminder of the resilience that we have as human beings, and that together we're going to overcome this. I'm entering the hospital now. I'm going to head upstairs now, start my job. Okay, so I have a consult on the floor already. Here we go. Gonna go to the floor where they've called me. Oh, this is nice. Looks like there's protein bars for whoever needs them throughout the night. Didn't know about that. It's helpful. And here we are. All right, so everybody working hard. Gonna find the patient that I need to address. I'm here because I just brought someone here. We had a lady that I was asked to see on the floor who was having a real hard time breathing. So I've just intubated her, and she's now on a ventilator. I put in a central line in order to give her some medications to support her blood pressure, and an arterial line to monitor her blood pressure appropriately. We have patients who are ranging in age from the youngest being 31 currently, and we've got hi guys. How you guys doing?
We're doing good, hanging in.
Working hard.
Yeah, fighting the COVID.
Fighting the good fight. Yeah, keep working hard, guys. We love you. So we have patients here ranging in age from 31 to in the 80s, and we're working hard to save them. We have our ICU team here. Hi guys.
Hey.
Everybody's working hard, awake despite the late hour. It's been a busy night, but I'm now going to sit down and write some notes. The notes are sort of a way to communicate from one doctor to another, or one team to another. Okay, here we are in 10 East, where we've been called to a bedside to see a patient who is having some problems with oxygenation. So we have a respiratory therapist here, and we're going to go take a look. Hey. And see if this patient requires mechanical ventilation. All right, so today I have an anesthesia resident helping me out.
How you doing?
On this night shift. So we're doing okay. Right?
Yeah.
We're having a decent night. We're taking care of critically ill patients, but It's a bunch of teamwork, and we're having a pretty decent night considering how busy it's been.
And so far, so good.
So far, so good. Okay, so it is the morning of Sunday, April 5th, and I have just finished my night shift. And I'm gonna I'm actually getting ready to go home now. I walked out. A little mark here from wearing my mask all day. But we made it through, and I'm gonna head home and get a little rest. I woke up a little while ago. I was thinking about one of the patients who I saw who was very sick yesterday. She was only 34 years old, and she was really struggling with her breathing. She had acute respiratory failure, and I had to put her on the ventilator. It was pretty challenging to do so, but you know, we got it done safely, and took her to the ICU to continue management for her respiratory failure with COVID. When I think about the upcoming week, I'm going to be off tomorrow, and then from Tuesday on, I'm working the entire week. And it's a little bit scary because it's supposed to be the peak. But I also, we set up sort of a backup system so that if it gets extremely busy, then there's another physician who can help out. Those of us who are in-house, there's several critical care doctors in-house. Even at night, there's several of us, and so we always help each other out, but if we need more help, it's there. So as we come into the upcoming week, it's a possibility that might need to be used. Until then, I'm going to try to get a little rest and a little family time.